We're here with Sergeant Shane Scherer. Is that how you pronounce
Correct.
it? Okay. And we're going to talk about his traumatic brain injury. So first of all, Sergeant Scherer, why don't you tell us how you were injured?
I was injured in the Nuristan province of northern Afghanistan by a B-10 round, which is a direct fire mortar round that is shot off of a tripod. So initially all you have to do is point this weapon at whatever you want to shoot and pull the trigger, and it'll most likely hit it or at least get close enough to do some damage. I had just gotten back from the gym. I was waiting to use the phone to call home, and out of nowhere, this B-10 round hit the truck behind me, went in through the trunk, blew out through the door jamb, and actually hit the ground. They estimated 7 to 12 feet away from me and actually exploded, and that's how it actually happened.
Okay, and so then what initially was your injury then?
At that point, I had a huge piece of shrapnel stuck in my head. I had a penetrating head wound. I had shrapnel embedded in my legs from about my hips down to my feet. I smacked myself in the face with my right hand, fracturing my index finger in 8 places, rupturing the flexor tendon in my thumb, and that was the initial injuries as far as the blast.
Okay. What was your treatment like right after your injury? Where did you go?
I went to, they stabilized me at the base. They moved me to Fob Bostic, where the surgeon there was like, his head swelling at an exponential rate. I need to perform a emergency craniotomy to reduce the swelling, which is essentially just cutting a hole actually in the skull to reduce the swelling. Problem was, he was a general surgeon and not a neurosurgeon. So he got on the horn and started calling all the local combat outposts and board operating bases until he found a neurosurgeon that would be willing to walk him through the procedure via the phone. So I had a life-saving procedure performed literally over the phone.
Wow, that's amazing. My goodness. So then where did you go after they stabilized you? Did they send you to Longstuhl?
Correct. I went to Longstuhl. They actually made the hole in my head bigger in Longstuhl because it was my head was still swelling. After I spent time there, they stabilized me to send me back to the States, where I was at Bethesda Naval Medical Hospital for about a month and a half, getting better there. I had like 20 some odd surgeries or something while I was there to fix everything. And then they sent me to the VA in Palo Alto for acute care because all my family's in California, so that's a kind of an important deal.
Right.
And then after 2 months of that, they transitioned me over to the polytrauma transitional rehab unit, where I spent 4 months there before coming to the Warrior Transition Battalion at Fort Lewis.
Okay. When were you diagnosed then with TBI?
I was out of it, like I wasn't unconscious. I was like medically sedated until the injury happened May 29th, and I didn't really start coming to like coherent as far as being receptive and being able to communicate. I had to relearn to talk, so that was kind of a barrier as far as the communication thing. I could nod and stuff like that. So to actually classify or say that I had a TBI took about a month and a half before they actually formally diagnosed. They obviously thought that was probably the case, considering I had a penetrating head wound and I was so close to the blast, the concussion of the blast. But until I was speaking and able to participate in the testing that was required to make that determination.
Okay, great. And how long have you been here at the WTB at Fort Lewis?
I got here December 5th of last year.
Okay, so not too long then.
Right.
Okay. And how has your treatment been for your TBI here at Madigan?
I actually got turned down from the traumatic brain injury clinic because my test scores were so high from Palo Alto, which, I mean, if anybody I had 8 hours of therapy a day, Monday through Friday. I lived where I did therapy, so no knock on Madigan's TBI clinic. It was just that I had a lot of therapy prior to getting here. So I'm doing a VA-sponsored Learning RX, which is a cognitive retraining program. It's 3 times a week with a one-on-one coach, and then 3 hours of on my own computer time.
Okay.
So.
And who has been kind of your support system throughout your treatment?
My fiance is the rock. She's the go-to person. Anytime I wanted to quit or thought I wasn't good enough or couldn't do something, she very quickly reminded me that, you know, that I'm very capable, and she's been there since. She actually was in Texas. She was moving to Texas from San Diego to be there when I redeployed, and she got the phone call the day after she got there saying that I was being medevaced from Landstuhl to the Bethesda, and she was on the plane the very next day, and she's been with me ever since. So.
Oh, that's great. What are some struggles that you faced with your TBI? I know you talked about the fact that you had to relearn how to talk. What are some other things, some like everyday things that maybe the rest of us take for granted that you've had to relearn or have trouble doing now?
As far as relearning, I had to relearn how to walk. I was in a wheelchair for almost 3 months, and because my balance was awful. It's still not impeccable, but I mean the nobody can stand on one leg, close their eyes, and you know, if I don't meet the standard as far as, you know, obscure balance, you know, equations, then that's fine. But I had to relearn to swallow. I had the pleasure of having an awesome puree diet for about a month, and that was probably the most awful thing. Babies, I don't know how they do it, probably because they don't know anything else. But and then there's been little things like when I first got injured, I injured the right side of your brain. Apparently is math, logic, and reasoning. So small stuff like tipping, like adding $15 onto a $35 bill. Like I was pulling out the cell phone, wouldn't even, I'd be sitting there for 10 minutes trying to figure that out.
Wow.
And that's one of the things that it really bothered me on initially, and when I was in Palo Alto, they hammered away and reinforced that, I still know how to do math, and it's a learned ability. It's not something that, so I was able to overcome that. As far as like my attention it wasn't where it used to be. Like I used to be able to sit down and read 65, 85 pages in a book. Now I'm good to hit, if I hit 30, then I'm just in la land or start forgetting what I read. And then processing speed is probably the only other significant deficiency. Like somebody can tell me something and I hear it, but it just takes an extra second for whatever's wired in my brain for me to kind of get it. Okay. So we're kind of like on a delay sometimes.
Right. Well, what would you want the public to know about TBI?
I would like them to know that this is a huge issue. I had never heard the term traumatic brain injury prior to actually having one. I heard of MTBI and that it was associated with the concussions from improvised explosive devices. I think everybody goes into a situation like going into combat and thinking that nothing's going to happen to them because who wants to be a worrywart and that. But just that this is a real problem and that it's exponentially getting worse, and more service members are coming back experiencing TBIs, and just that it's the hidden disability. You can look at me and go, there's nothing wrong with that guy, but according to the medical professionals, I have a disability now. And in some extreme cases, people do experience severe social problems, and they have a hard time adjusting. And I'm fortunate that I didn't experience those to the magnitude that it prevents me from living a normal life or whatnot. So I guess just educating the public as far as that this is a real thing and that people do have this. I mean, it happens in everyday life too, car accidents, people fall off bikes and whatnot, but just that it is there and it is prevalent, and more and more people are going to come back with this problem.
Well, thank you very much for your time today.
Absolutely.
Nice to meet you.
Thank you.
Thanks.